Hey guys, we are going to be talking about the vagus nerve. Now, what happens in Vegas does not stay in Vegas in this context when we are talking about the vagus nerve. We are going to describe for you what is the vagus nerve, what does the vagus nerve do, what are some signs and symptoms of the vagus nerve poorly functioning or having a dysfunctional vagal tone. As well as we're going to be able to go into some discussion about ways in which we can evaluate for or test the vagus nerve function. And then most importantly, we're going to get in some ways to be able to improve and stimulate the vagus nerve. All right, guys, thanks for checking in here today. This is Dr. Tim with Optimize Wellness Center. If you like this video, press the like button. Make sure to subscribe to our channel and share this information with your family, friends, and loved ones who may find this valuable, and check in for our next video on the upcoming Friday. All right, let's dive in. So if you happen to be dealing with any kind of anxiety disorder or heart disease or tinnitus or obesity or alcohol addiction, as well as things like migraines or Alzheimer's or other neurodegenerative conditions, as well as things like leaky gut or poor blood circulation or mood disorders, cancers, as well as autoimmune conditions, did that seem to be any one of you? Well, if it is, then this is the video for you. All right, guys, let's dive in. So first off, we said we were going to describe what is the vagus nerve. Well, the vagus nerve is the 10th cranial nerve, and it is arguably one of the most important parasympathetic nerves of our nerve system. And this is the part of the nerve system which is associated with rest, digest, and repair. And notably, it counterbalances the sympathetic nervous system, which is all about fight or flight or freeze. And so, unfortunately, in this day and age and in our culture, many individuals are under high levels of stress on a very continuous basis, and they are flying high on sympathetic tone. And this is where the vagus nerve comes into play to try and help to ameliorate that. Now, the vagus nerve is by no way the only nerve that controls our ability to be able to decrease stressors, but it is by far the single most important nerve to do this, and it has far-reaching effects. Now, it serves as the primary interface and communication highway between our gut or our microbiome and then up to our brain. Now, I'm going to describe that in greater detail in a moment. Now, the word vagus, though, means wanderer in Latin. And the reason for this is because of its very circuitous and wandering pathway throughout the body, and where it actually has innervation into so many different organs, as well as it imparts signals both bidirectionally from all these organs down here upstairs, as well as going back down again. Now, this starts in the brain stem, which is a particularly complex neurologic region. Right at the base of our brain is what we think of as our brain is something called the brain stem, and it's basically Grand Central Station. Now, it's the only cranial nerve, though, interestingly enough, that actually leaves the cranium, or this cranial cavity, and it runs bilaterally on both sides of our neck, and it goes down through all of these different organs. Now, it leaves out of what's called as the carotid sheath, and this runs it runs right alongside, inside of this sheath that protects it, adjacent to the carotid artery and the jugular vein. Now, this is important because those are the primary ways that we get blood to and away from the brain. Now, the brain is starving for energy and information, and it gets that predominantly through blood. So this is really important because this is a nerve that runs alongside that and helps to regulate this functionality. Now, the signals from the brain, these are both electric and what's called as biochemical signals. These charges pass from one neuron to the next, and they cross what's called as a synapse or a synaptic cleft via a neurotransmitter, which in particular is called acetylcholine in the instance of vagus nerve. Now, ACH, or acetylcholine, is a very important neurotransmitter because it's the way in which it's going to be able to continue its pathway of communicating from one location to the next. Now, this nerve connects our brain to our gut. In this instance, we're talking about the intestines and the stomach, and it's connecting every organ in the thorax, this whole chest area, and the abdomen, including our heart, our liver, our pancreas, our gallbladder, our kidneys, as well as things like our ureters, our spleen, our lungs, our sex organs, in particular for females, as well as in the neck, we have our larynx and pharynx, that are, as well as our ears and our tongue. Holy cow, that's a long list. Now, I'm glad I get to breathe because the vagus nerve is associated with breath. Now, no other nerve in the body has such a broad and far-reaching effects as the vagus nerve, and hence its great importance. 80% or so of the information that runs along the vagus nerve is what's called as afferent, meaning it's ascending. It's going from down here all the way up there. And so this information that's coming from our organs and going to our brain is super important because it creates what we call as our second brain down here, a communication pathway between the two. This gives a signal that is allowing for that to be able to happen from the microbiome all the way up to what we normally consider as our brain. Now, 15% of the communication is from the brain down to these organs called efferent. And this is parasympathetic calming, which helps us to recover from the stressors in our life, as well as counterbalancing sympathetic nerve signals. And remember, guys, that sympathetic nerve signal is the fight or flight. That's running from the bear. That's where there's an adrenaline rush and so forth. And around 3 to 5% of the signal is going to muscle control, and that's associated in particular with our throat and our ability to be able to create pitch or tone. So notably, pay attention here, folks. If you know someone who has a monotonous voice, they speak in a monotone way, this could be an indicator of what's called as poor vagal tone or poor vagus nerve stimulation to the larynx and pharynx, and instead of having a more dynamic ability to be able to create phonation as well as tonation. Now, the last percent or two is associated with the hair and the skin, in particular in the inner ear, where we have some unique sensations. Now, as you guys will see here on the board, I did note here that it is the number one parasympathetic nerve, as well as there are two branches that are notable for the vagus nerve. First and foremost is the ventral or forward branch, and this innervates the structures which are above our diaphragm. Now, the diaphragm is basically this shelf that sits at the base of our rib cage, and it holds the upper organs separate from our under organs, upper and under of that diaphragm. And so the dorsal branch innervates those lower organs, notably the stomach, intestines, colon, kidneys, bladder, etc. Now, there are four components to this as well, which are important to recognize. There's sensory stimulation of this nerve, and this is associated in particular with the inside of the ear, but also, interestingly, in the posterior part of our throat, as well as in our heart, lungs, and abdomen. And there's special sensory information that comes from the epiglottis, way in the back of the throat, as well as where that kind of connects with the tongue. And this is an area where we have taste sensation. There's also motor control, meaning that it has the ability to create some kind of muscle function with our larynx and pharynx, as I mentioned earlier, about the ability to be able to create phonation and tone. And then there's parasympathetic stimulation, meaning it's calming things down, associated in particular with our heart, lungs, and other organs associated with our digestion. And then there's something called opaque neurons sending ascending information going from our visceral organs, these organs down here, all the way up to the brain. I know that's a lot of information. All right, we're done with that section, guys. Let's move on to what does the vagus nerve do? Well, you can imagine, since it innervates so many different locations, it has a very extensive list. So in the brain itself, it helps to control our anxiety, our mood, as well as our ability to be able to create memories, and that's specifically associated with the limbic system. Now, it also provides sensory information to the skin inside of the ears. We mentioned that earlier. It manages our airways associated with our vocal cords and controlling our breath. In our heart, it is able to control our heart rate variability, meaning the ability to be able to create this change and shift that's constantly occurring between our inspiration and expiration. As well as our ability to be able to manage our true heart rate and our blood pressure. It also manages our hunger and satiety, meaning how full do we feel or how hungry do we feel. It allows us to be able to swallow foods. In addition, in our gut, it helps us to increase what's called the stomach acids, the gut's flow and motility, meaning when the food is churning and is going from here to there to somewhere. And then as well as our digestive enzymes. So low stomach acid is a major source of gut-related health conditions, and so we would want to avoid that, and that is often an indication of low vagus nerve or underperforming vagal tone. So, as I mentioned up here, guys, you can see in this little diagram here, I mentioned how the brain controls our gut, and our gut controls our immune system, and our immune system controls our brain. Now, this can go, in fact, either direction, and so back and forth and so forth. But it's important to know that bidirectionality, and the majority of that communication is occurring through the vagus nerve. Now, some other areas where the vagus nerve has control, and what it does is in the pancreas, and this controls our blood sugar balance as well as our digestive enzymes. So we need enzymes to actually start to initiate the breaking down of foods chemically, essentially. Then in our liver, it controls the bile production as well as the ability to be able to perform detoxification. And this is through hepatic or liver phase 1 and phase 2 conjugation. Then separately in our gallbladder, this is where it controls the release of the bile, and it helps to break down fats. And then notably in our kidneys, this promotes the general functions, including our water balance, glucose control, sodium excretion, as well as it controls our blood pressure, as we mentioned earlier. All the way down into our bladder, it helps to facilitate voiding of urine or micturition. And then on our spleen and our gut, it manages and reduces inflammation, as well as in our sex organs, gosh, I should get that one right. It helps to control fertility and sexual pleasure, including an orgasm. And then if we go all the way back up here again, guys, don't stay down there, go back up here. In our mouth and in our tongue, it helps to control our ability to be able to have taste and saliva production through our salivatory glands. And then it also manages the activity of our immune system. Whoa, that was a lot of stuff. Now, the vagus nerve is stimulating so many different areas, and so you can imagine that many individuals could suffer from various health conditions if they have any kind of diminishment of vagal communication or tone. And this can include things like anxiety disorders, heart disease, as well as some forms of cancer, poor circulation, leaky gut, Alzheimer's, memory and mood disorders, migraines, headaches, fibromyalgia, obesity, tinnitus, addiction, autism, as well as other kinds of autoimmune conditions. No one wants any of that stuff. So I want to encourage you to be able to try and figure out how to observe as well as enhance your vagal tone. Now, there is lots of other research and information that is relevant to the gut-brain axis. If you all want that information, please contact us and we'll be able to share that with you. I encourage you to subscribe to our channel and like this video before doing that, and we will make sure to send you that information. In short, there are these little microbes in our gut that interact with immune cells in our gut, and they start to send what's called as our endocrine system. This is a neurologic system in our gut, and it starts to send communicating information from here back upstairs, as I was describing here, from the gut to our immune system and then back upstairs to our brain. So that is super important if you want to stay healthy. Now, there's some other good information about our gut and our immune system. Again, send us a message and I'll make sure to be able to share that with you. What are signs of a poorly functioning or dysfunctional vagus nerve? Well, as you can imagine, yet again, there are lots of signs and symptoms. All right, so let's go through those. Okay, guys, you ready for this list here? It is a litany. Chronic constipation, depression, anxiety, gut dysbiosis, having trouble digesting food, GERD, low stomach acid, slow and or fast digestion, IBS, as well as small intestinal bacterial overgrowth, or otherwise known as SIBO, stubborn infections like upper respiratory infections, or even more chronic things that are terrible like Lyme or mycotoxins, hives and histamine overload, as well as food sensitivity issues, emotional dysregulation, trouble swallowing, low blood pressure, as well as dizziness, fainting or nausea, autoimmune diseases, neck pain, as well as headaches, brain fog, and memory issues, in addition to a decreased heart rate variability, as well as chronic fatigue and lethargy. I know that's a long list. Well, because it innervates so many areas, that is the truth. So the vagus nerve has a profound effect on our immune system, and this is through what's called as cholinergic tone or vagal tone. And so it is really important that we get our vagus nerve functioning properly. Well, how do we test our vagus nerve? All right, guys, here we go. So the easiest way at home that you can do this is through what's called as bowel transit time. So if it's either too fast or too slow, this is not right. And that means that either we're not digesting foods properly, or the peristalsis, the churning of that food, is moving too fast or too slow. So the easy way to be able to test for this is to either consume some white sesame seeds without chewing them significantly, or corn, and you're going to drink them down with a bit of water, and they generally won't digest. And so you want to mark the time that you ingested them, and then mark precisely how long until you started to see them show up in your stool. You want to then subsequently mark the last time that you saw them in the stool. Now, this should be somewhere between around 12 to 24 hours, but optimally around 16 hours. If it's beyond that or less than that, then there may be a problem. Other mechanisms of evaluating for vagal tone include heart rate variability. This is where you monitor the flexibility of your heart rate, specifically as it relates to your inspiration and your expiration. And the heart rate should be around 60 beats per minute or lower, ideally, when you are at rest. And the variability is looking at how much variation there is between those beats. So the higher the variability, the better the vagal tone, in short. You can also use some tools and some electronic devices to be able to monitor this, like an Oura Ring or something, some software called CoreSense or HeartMath. These are some other tools. Also, consider looking at something called orthostatic hypertension. This is where there's a 20 beats per minute change in your blood pressure, going from sitting to standing. And if it's greater than 20, that would be a good indication that there may be heart rate variability issues and orthostatic hypertension, and specifically related to your vagus nerve and having a dysregulation there. You can also look at what's called as pupillary constriction. This is where you shine a bright light into the pupil, and it should constrict, and it should be able to hold that for a reasonable amount of time. But if after less than 10 seconds it blows back out and goes open again, that's a good indication that you don't have very strong vagal tone, and we would need to be working on that. Another way that you can evaluate this is looking for what's called as an asymmetric soft palatal paresis. We have uvula and soft palate on either side in the inside of our mouth there. And if one is hanging lower than the other, that is a good indication about poor vagal tone and regulation. As well as, interestingly enough, chronic tension in these cervical extensor muscles. These are the muscles that help you to extend your neck backwards. And if those are chronically tense, that's another good indication of poor vagal tone. All right, guys, I know you've all been waiting for this, so let's talk about some ways to be able to improve vagal tone. I have 10 terrific ways to be able to do this and some bonus points for you. All right, so first and foremost, neurologic stimulus. Well, the vagus nerve, cranial nerve 10, is a nerve, and so it would be able to receive neurologic stimulus. But since it comes from an exceedingly complex area, I would strongly suggest that you only have it evaluated and subsequently adjusted by a doctor of chiropractic, where we would not be using a manipulation of that region, and by contrast, we would be using a very specific amount of force into a very precise location. Now, other things that you can do are things like cold exposure. You can use a very vigorous gargling activity, deep breathing, or what I train in office is diaphragmatic breathing patterns, as well as meditation. You can use some chanting and humming with the Om sound in particular. Fasting, and notably intermittent fasting, seems to be effective, as well as acupuncture, in particular into this auricular or ear region, as well as eating in a very relaxed state, since the vagus nerve is a parasympathetic nerve, and that's focused on rest and digest. We want to be relaxing while we are eating. Notably, we also want to make sure that we're getting in the right kinds of foods that will facilitate the production of neurotransmitters that the vagus nerve uniquely utilizes, like acetylcholine. And so that could include things like egg yolks, as well as high quality organic meats and soy lecithins. And you can use massage or acupressure techniques to be able to massage either in your ear or in your foot to be able to stimulate the vagus nerve. You can use also limited or light exercise, things like yoga or Pilates or Tai Chi. These are some other ways to be able to do this. Now, there are some other ways that you can do this, guys, but some of these, I must admit, I would really suggest that you be able to be working with a skilled professional to be able to do this. Now, obviously, getting proper sleep, deep, restful sleep, isn't really of issue, except if it's challenging for someone, you might need some assistance. But there is a technique called mouth taping that tends to be very helpful, since breathing through the nose is parasympathetic and breathing through the mouth is sympathetic in tone. So mouth taping seems to be very effective in the research, showing that it has the ability to be able to stimulate the vagus nerve. As well as humming and singing, as we mentioned earlier, using the Om sound. Gag reflex. Now, this stimulates the pharynx, where you try to provoke a gag reflex. This doesn't mean that you need to vomit, guys. Don't get me wrong. It just means that you're trying to force your body to be able to promote this kind of reflex. You can also use something called auricular 10 stimulation. Again, this would probably be best if you had a doctor be able to provide you some description and instruction about how to do this. We put some TENS pads in very specific areas of the ear, and we create a nearly imperceptible tone or signal in there, and it stimulates the vagus nerve. We can also use vibratory stimulation along the thoracic outlet, as well as something called nerve flossing, where it's a very specific technique where we're going to be doing a flossing program, or we can do it in the lower extremities as well. To do some nerve flossing, and then something called photobiomodulation. This is where we're going to utilize what's called as low-level light laser at 635 nanometers in particular. Unfortunately, LEDs don't seem to be able to be particularly effective in this instance, and we would use this laser along the route where the vagus nerve flows bilaterally throughout the entire body. So, well, what effect is this going to have? Well, it's going to have a variety of effects of amplifying what's called as neurogenesis. This is the sprouting of new brain cells. This is fantastic. This means that you don't have to become a dummy as you get older. You can actually sprout new neuron cells. Now, it can also rapidly turn off stress or hyperarousal or fight or flight signals through a relaxation response. It can sharpen your memory. It can fight or mitigate inflammatory diseases. It can resist high blood pressure. It can block hormones like cortisol and oxidizing agents that would degenerate your brain as well as other tissues in the body. It can also block systemic or body-wide inflammation, which would result in pain patterns or poor health and quicker aging patterns. It can also help to overcome depression and anxiety. It can help you to sleep better and improve your immune function. It seems to also raise what's called as human growth hormone. And this is the ability for your body to be able to generate hormones to fight off disease cells and to provoke the right prosperous cells for your immunity in your body. It also can help us to overcome insulin resistance. And this is super important for things like diabetes as well as blood sugar dysregulation kinds of issues. It can help to mitigate allergic responses. And so, allergies in general are really an obtuse response to something that's natural in our environment, and so this can help us to mitigate that. It can also help us to spare and or grow new mitochondria, and those are the powerhouses to the cell that help us to be able to have energy to fight off invaders as well as to do the normal activities that we want to do, as well as it helps us to live a longer, healthier life that is more energetic. All right, guys, that was a ton of information. I'm so excited we were able to share this today. Please make sure to like this video and subscribe to our channel and share this with your family and friends and loved ones, and check in for our next video on Friday. Dr. Tim with Optimize Wellness Center.